Today we will discuss regarding child abuse and neglect. The learning objectives are define child abuse, list down the types of child abuse, enlist the causes of child abuse, enumerate the signs of child abuse and neglect, narrate the diagnostic measures of child abuse, explain the management and prevention of child abuse, describe the nurse's responsibilities of child abuse. So, child abuse is not just a physical violence directed at a child, it is any form of maltreatment by an adult or family member which is violent or threatening for the child. Social problems also has an impact on the well-being of children as child abuse and neglect. Next, we will see the definitions of child abuse, neglect and maltreatment. First one is child abuse. It refers to a parent or caregiver, whether through action or failing to act, that causes injury, death, emotional harm or risk of serious harm to a child. In many cases, the child abuse is done by someone the child knows and trusts, often a parent or other relative. Next, we will see neglect. It refers to a range of circumstances in which a parent or caregiver fails to adequately provide the essential needs of the child, and it includes not providing any medical, physical, nutritional, or educational care that leads to general neglect of the child. Next, we will see the definition of maltreatment. It is a behavior towards a child that is outside the norms of conduct and it entails substantial risk of causing physical or emotional harm to the child. Next, we will see the types of child abuse. There are 4 types. First one, emotional abuse. Second one, physical abuse. Third one, domestic violence. And fourth one, sexual abuse. So we will see one by one. Emotional abuse. It refers to the psychological and social aspect of child abuse, and this is one of the most common form of child abuse, and it includes isolating, intimidating or ignoring the child. Next we will see physical abuse. It refers to any act of violence that causes body injury to the child, and it includes striking, shaking, kicking, biting, burning or poisoning the child. Next we will see the definition of domestic violence. It is an act of violence or abuse against the child, especially by a member of one's immediate family, and that includes the child caregiver. And domestic violence include psychological, physical or sexual, financial or emotional violence against the child. Next we will see sexual abuse. It is a form of abuse that includes sexual activities between an adult and a child to satisfy the sexual desire of the adult, and it includes physical sexual contact, rape, homosexuality, sexual harassment and sexual exploitation. Next we will see the causes of child abuse. First one, parental negative attitude towards the child. Next, poor parenting methods. Third one, parental mental health problems, like if the parent having any depression, schizophrenia or mania, this leads to child abuse. Next, if the parent is a drug and alcohol user. So they will use the child in unwanted ways. And other causes are poor socioeconomic status of the family, more number of children in the family, stress of the parents, and strict behavior of the parents. So next we will see the signs of child abuse and neglect. So if the child face or undergone any abuse, the child will have depression, anxiety, and low self-esteem that leads to suicidal behavior. And the child behaves aggressively and antisocially, and also they will face difficulties with academic achievements and school attendance. And these children, those who underwent neglect or maltreatment, these children will show signs of malnourishment, poor personal hygiene, and they have problems in developing friendship and relationship in the society, and they have marks over the body and fracture. And these children also have long-term developmental problems, and they will have pain for no medical reason. Next, we will see the diagnostic measures to identify child abuse. First one is history, physical examination, chest x-ray, and CT scan. So, while we are taking the history, we have to collect relevant history regarding the present situation of the child and the family background and the socioeconomic status of the family, and we can collect more details regarding the type of abuse that the child underwent, whether it is a physical, emotional, domestic or sexual abuse. So after collecting detailed history, we can do a thorough assessment, and by assessing the child we can identify if there is any marks over the body like burning marks, any bruises. So this we can identify, and also by taking the x-ray, chest x-ray and CT scan, we can see whether there are fractures, blunt injuries or contusions. So these are the ways we can diagnose the type of child abuse. Next, we will see the management of child abuse. First intervention is counseling, and we have to counsel the child's parent or the guardian. So this is a important aspect of the treatment. And other recommendations are physical and psychological therapy for the abused child. Next, the child abuser may be imprisoned, or we can remove the abused child from the home to prevent further harm. Also, the decisions regarding the placement of the child with an outside caregiver or returning the child to the home will be determined by the government agency working within the court system based on the severity of the abuse and the likelihood of recurrence. Next, we will see the prognosis of child abuse. Mainly the prognosis depends on the severity of injury, actions taken by the authorities to ensure the future safety of the injured child, and the willingness of parents or guardians to seek counseling for themselves as well as for the child. Next, we will see what are the preventive measures of child abuse. First one, recognizing the potential for child abuse. So early recognition is an important aspect to prevent child abuse. Next, offering offering earliest medical interventions is essential. And third one, counseling. Counseling mainly provided to the parents or the guardian, and we can provide training to the parents regarding good parenting skills. And we have to get the support from the extended family, friends, and other supportive persons or groups. So these are the ways we can prevent child abuse to some extent. Next, we will see the nurse's responsibilities. The nurse should provide healthcare and routine examination and administer medications, especially for pain. Nurse can educate the victim and the caregiver regarding self-management, and the nurse can provide emotional support by listening and allowing the patients to express their feelings. And the nurses can refer the patients to a counselor, and they can recognize symptoms of depression or suicidal tendency. So every child deserves to grow up feeling safe and loved. Thank you.